Good morning everyone. Today I would like to tell you about gestational diabetic mellitus. For that I follow this presentation. If you have any question during this my presentation, you can ask me. Do you have some idea about gestational diabetic mellitus? Someone can tell what are the definition of gestational diabetic mellitus? If you can tell. Following this topic, I like to talk about what is the gestational diabetic mellitus, adverse effect on mother and baby, management of diabetic during pregnancy, medical nutrition therapy, some example of food item and glycemic index. Do you have understand? After my lecture, you should be able to gain a lot of knowledge about the following point. Describe the gestational diabetic mellitus, discuss the risk factors, list out adverse effect on both mother and baby, discuss the medical nutrition therapy. First, let's see what are the gestational diabetic mellitus. Someone know the definition of gestational diabetic mellitus? If you can tell, gestational diabetic mellitus is defined as any degree of glucose intolerance with onset of first recognition during pregnancy. Now you can see this diagram. It shows how the glucose level is increased. First one is placenta produce hormone. There are estrogen, cortisol, and human placental lactogen. These hormones are inhibit the functioning of insulin. You can see this one. This hormone inhibit the functioning of insulin. That result, blood glucose level is increased. Can you understand? Placenta produce hormone, estrogen, cortisol, and human placental lactogen. That hormone inhibit the functioning of insulin. That result, blood glucose level is increased. That are the gestational diabetic mellitus. Next we see how gestational diabetic is harmful to babies. Congenital malformation such as congenital heart disease, anencephaly, microcephaly. This condition can be identified before delivery using anomaly scan. And sudden fetal death, macrosomia leading to birth injury, neonatal hypoglycemia, hypercalcemia, hypomagnesemia, neonatal jaundice, childhood obesity and metabolic syndrome, increased risk of developing diabetes in early life, macrosomic, this I talked to about macrosomia. Many pregnant mother's baby are last baby due to we call to macrosomic baby. That the result of diabetic during pregnancy. Have understood what I have said so far. If you have any question, ask me. Let's see how to gestational diabetic is harmful to the mother. Increased risk of preeclampsia. Preeclampsia means increased blood pressure during pregnancy. That condition are the major problem in Definition are the major problem in during pregnancy. Yeah, other than spontaneous miscarriage, premature delivery, pre-existing diabetic retinopathy, nephropathy, and neuropathy. I think you know what are the complications of diabetic mellitus. If you can tell, do you know about it? What are the complications of diabetic mellitus? Complication are the diabetic mellitus is diabetic retinopathy, nephropathy, and neuropathy. These are effect to the pregnant mother. Increased tendency of develop infection, increase in the need for cesarean delivery. Cesarean delivery, many mothers have to do a cesarean section because the baby is large. And large baby difficult to deliver in normal vaginally because there is a big chance to shoulder dystocia that is harmful for baby lives. Therefore, many mothers do a cesarean section. Increased risk of developing type 2 diabetic mellitus later in life. Next we look about how to manage in diabetic mellitus in pregnancy, before delivery, care during delivery, and immediate postpartum and after delivery. First of all mothers is identify in diabetic mellitus. Firstly, we advise to controlling their diet. Before we start medication, we refer to medical nutrition therapy, and we give a health education regarding self-monitoring blood glucose level. In addition, it is advised to do at least 30 minutes of physical activity a day. If the blood glucose level exceed the normal value, we have to start medication. First of all, they give oral drugs. If they cannot control the oral drug, they have to give insulin therapy. During this period, we investigate the blood glucose level is regularly. Do a oral blood sugar series. Investigate blood sugar series. Do a blood sugar series to identify the blood glucose value. During the antenatal period, the baby can be managed by anomaly scan and growth scan. The first treatment of mothers with diabetes is maternal nutrition therapy. In our hospital, we refer mothers to a nutritionist. Our nutrition give a diet plan to the mother. They give a diet plan. Before giving the diet plan to the mother, they should know about how to nutritional status, pre-pregnancy BMI, and how to her weight gain, what are the nutritional pattern, like that. Ask about by nutrition, and some normal weight gain during the pregnancy. An average pregnant mother weight gain, normal pregnant mother weight gain average 10 to 12 kilogram, but the gestational diabetic mother can increase the weight gain more than 12 kilogram. In a pregnant mother, in first visit of pregnancy, first visit in antenatal clinic, pregnant mother check blood glucose level. Firstly, checking by using an oral glucose tolerance test. That time we can diagnose high glucose level. We refer to the mother for maternal nutrition therapy and other medication, and we investigate the mother to regularly follow to the investigate check glucose level. We can't identify in first visit in clinic. Next we do a glucose test in 28 weeks using an oral glucose tolerance test. That can diagnose gestational diabetes. We follow to the mother first medical nutrition therapy, and next follow to the other therapy, likewise medication or insulin therapy, like that. If some other identify that time, follow to mother for glycemic control. This is the common example of food item and glycemic index. Glycemic index less than 55 this food, and 56 to 69 average this food. And now you can see in this diagram more than 17 these food. I think you can take some idea about this diagram. Finally, I would like to give you a little assignment. Can you write down this question? I tell you, if you can write this one. First one, discuss regarding intranatal and postnatal care. Do a health education session about dietary control for a pregnant woman with gestational diabetic mellitus, and read to research article regarding maternal nutrition therapy. For this one, you can use internet, and you can use look many research articles. And if you want to get a maternal nutrition therapy, about maternal nutrition therapy, you can ask take some idea about our nutritionists. This assignment for you. If you have any question, ask about